We get a ball of cotton and shape it into a ball just as it is, while it's dry like this, and we use it to close the ear, inserting it inside the ear until it completely seals it. But doctor, if water gets on the cotton, it will get wet, shrink in size, and let water inside the ear. No, after we completely seal the ear with the dry cotton like this, we get Vaseline. The Vaseline sold in pharmacies that everyone knows, and we apply it on the outside of the cotton. By doing this, we achieve two benefits. First, we make the cotton seal tightly, ensuring a 100% closure. The remaining benefit is that the cotton does not get wet. If we apply Vaseline, it acts as a waterproof barrier, preventing water from penetrating, so the water slides off the cotton itself and does not wet it. Peace be upon you, doctor. Can water entering the ear cause harm? Yes, it can cause harm, especially if there are certain conditions present inside the ear. We prefer that water never enters the ear. Now, before we talk about water entering the ear, let's discuss the ear canal itself. How is the ear composed? Oh, there is the ear canal. There is a canal that is 3 centimeters long, ending with the eardrum, which completely seals the ear, separating everything we've mentioned from the middle ear. Everything outside is the outer ear, including the auricle, the ear canal, and the eardrum. Behind it is a space with small bones and air, known as the middle ear. So, what are the conditions that prevent a person from allowing water to enter? There are conditions where we tell the patient to completely prevent water from entering. These are the doctors who advise for example, a person who has a perforation in the eardrum, meaning the eardrum has an opening. If water enters this opening, it will pass through the canal and through the eardrum's opening, entering the middle ear and settling in that area. If there is an infection or a microbe, it's as if the skin is open and we have introduced water to the tissues beneath the skin. It's the same story, and therefore, anyone with a perforation in the eardrum is completely prohibited from getting water into their ear until the perforation heals, if it's acute, or until we take action with surgery, or otherwise if the perforation is chronic and has been there for 2 or 3 months or more. What else? Children often have tonsils and adenoids, and they neglect them to the extent that fluid accumulates behind the eardrum. Those who have fluid behind the eardrum, we perform surgery for them by removing the tonsils and adenoids and inserting a tube to allow air in, like a small opening we make in the eardrum. We place a tube in it to prevent this opening from closing. This means we, the doctors, want to keep the eardrum open, to allow air in and for specific purposes to prevent the disease from entering. Of course, we completely prevent the child from getting water into their ear, because if water enters through the ear canal, it will pass through the tube we placed and enter the middle ear. If it enters the middle ear carrying microbes, it can easily cause an infection. In both cases, whether there is a perforation in the eardrum or a tube is inserted, whether it's a child with a tube or an adult and with a ventilation tube for the ear, it is strictly prohibited to allow water into the ear. If water does enter, the problems that occur are infections, meaning an infection. For instance, after swimming, we might find the child or adult complaining that their ear is hurting and producing discharge. This discharge is a substance or fluid somewhat similar to nasal secretions, which we find coming from the ear. In such cases, we go to the doctor for treatment, and afterward, we prevent water from entering the ear. Okay, there are other things. Yes, there are diseases that are not related to the eardrum, but rather diseases in the ear canal itself. We don't want water to enter the ear to help it heal. What are they? For example, fungi. If someone has fungi in their ear, the common symptom of this fungus is itching. It makes him feel like his ear is itching. These fungi grow in a moist environment, so water entering the ear encourages the growth of fungi. Of course, we treat these fungi by giving instructions to the patient to stop water from entering the ear. But if water does enter, itching increases and the fungi multiply. But there isn't significant harm. There isn't pus like in other conditions where there is a perforation in the eardrum. So, what else do we find? Swimmers often come complaining due to their frequent exposure to water, swimming pools, and the sea. They experience itching in their ears, and it's not just itching or fungi, but inflammation. Inflammation means severe pain, making it difficult to move the ear. When they try to sleep or touch it, it starts to hurt. At that point, we find inflammation in the ear throughout the ear canal. Why does this inflammation occur? Due to excessive exposure to water, the ear canal, which God created with wax, is supposed to maintain a certain acidity level that prevents some microbes and bacteria from growing. When we introduce a lot of water, this wax completely dissolves or is removed, leaving the skin exposed to bacteria and altering the acidity level of the canal, leading to inflammation. At that time, we also prevent them from getting water in. What does it mean when the doctor tells the patient not to let water in if they have a perforation or a tube in the eardrum? The patient complains of severe itching if they have fungi and water enters their ear, or swimmers who spend a lot of time in the water complain of pain, not just itching, but pain and inflammation that require treatment, antibiotics and such. These individuals are also advised to avoid water exposure. Okay. Someone might say, when water gets in, I don't experience pain, itching or discharge, none of what you're describing, doctor, but when water enters after a fever or something, I feel like my ear is a bit blocked, it rings and whistles. This is often due to earwax, meaning they have compacted earwax in the ear. When water enters, the wax expands, causing more discomfort for the patient, making them feel like their ear is blocked or ringing and they can't hear well. We don't prevent them from getting water in, we just remove the excess wax and that's it. Now the next question is, what if I want to prevent water from entering? This is something we should consider, like when we perform ablution, take a shower, go swimming, or go to the sea. There are people who say, doctor, we should wear those earplugs sold in pharmacies, those plastic earplugs. Honestly, I advise most people who have these issues that these plastic plugs come in different sizes, and it's very difficult to fit them perfectly to the ear canal, so that when I put the plug in, no water leaks around it. It's difficult to get the right size, and it's hard to find rubber or plastic material that can prevent water from entering the ear, especially if there's a swimming pool or sea involved or similar situations. So what do? We take a piece of cotton, roll it into a ball, and keep it as a ball just as it is. And we close our ear with it, inserting it into the ear until it completely seals it. But doctor, won't the cotton get wet if water touches it, shrink in size, and let water into the ear? No, after we completely seal the ear with the dry cotton, we apply Vaseline. The Vaseline, the one sold in pharmacies that everyone knows, is applied to the outside of the cotton. This way we benefit in two ways. First, we've made a cotton plug that we feel seals the ear 100% effectively. The remaining benefit is that the cotton won't get soaked. If we apply Vaseline, it acts as a waterproof barrier, preventing water from penetrating, and the water slides off the cotton itself without soaking it. I hope what I've explained is clear regarding the situations where we prevent water from entering the ear. In these cases, we simply tell the patient not to let water into their ears and address the existing issue if it can be treated. Wishing you all the best. If you like these videos, please give them a like and subscribe to the channel so we know you're waiting for more videos from us.